I'd like to thank you all for making your way down on a Saturday afternoon. My name is Hiok, and I'm the chairman of this CPG. These are our first national guidelines on management of genital discharges and ulcers. And I think one of the reasons why we decided this was necessary is because, first of all, sexually transmitted infections, they are on the rise. All right? They remain certainly a very important public health problem for Singapore. And this is certainly the case throughout the world. If you look at epidemiology, you see that STIs everywhere are on the rise. It's not something that we can probably try to stop, although we should be looking at how to reduce the morbidity, from all these infections. STIs certainly can lead to acute symptoms as well as chronic infections and certainly serious potential side effects. And although many of them may be asymptomatic, if they do present with symptoms, you'll find that they often present with either a genital discharge or an ulcer. And so it was an appropriate thing to do the national guidelines on this. I'm just going to quickly take you through some of the epidemiology before we start this afternoon sessions. Now, if you look at the epidemiology of STI notifications over the last few years, you see that there has been an increasing trend, particularly in the last 10 years or so. In 1998, there were about 160 cases per 100,000 population, and last year, this has gone up to 253 cases per 100,000 population. If we look at the numbers, if we look at last year's statistics, there were more than 12,000 notifications of STIs. Many of you actually contributed to notifications, and this was a rise year on year compared to the previous year. One interesting thing, of course, is that since we started routinely testing for chlamydia has now overtaken gonorrhea as the most commonly notified sexually transmitted infection in Singapore. This is not surprising because chlamydia can occur on its own and is also often associated with infections like gonorrhea. Right? The other thing, of course, is we have cases of syphilis, but it's really infectious syphilis that we are concerned about as a public health issue. And although the numbers are small, they are also showing a slight increase, particularly in men who have sex with men. And of course, infections in youths, fortunately last year there was a slight decline, but over the last 5 to 6 years there has been a great increase overall. And if you look at the statistics here, you can see back in the 70s, the late 70s, numbers were really high, and then things plateaued down to quite a nice level in the 80s and 90s. I think part of this was because in the mid-80s, late 80s, you had the HIV scare as well, right? But if you look at the last 10 years, you can see cases are really going back up again. And if you look at gonorrhea, for example, as just an example, you can see that over the last few years, consistently, we've had more than 2,000 notifications every year. So it used to be the most commonly notified STI. The reason why we needed to have these CPGs is because aside from a group of doctors who routinely treat STIs, I think the general practitioner, if you don't keep up to date, you may not realize that there are a lot of changes in the recommendations for treatment. One of the examples is in the treatment of gonorrhea, where over the last 10 years we've seen a real rise in the incidence of quinolone resistance. So 10 years ago, maybe you used to use CIPROFLOXACIN to treat gonorrhea and you were assured of a pretty good rate of success. But if you use it today, you have a more than 70 to 80% chance of treatment failure because of the high incidence of quinolone resistance. This is infectious syphilis. And of course, genital herpes and other viral infections which are chronic, they can recur. So there's a reservoir of patients with these infections, and they can present with genital ulcers. In fact, genital herpes is the commonest cause for genital ulcers in Singapore. And finally, a graph on STIs by age group. You can see people in their 20s to 30s, 30s to 40s, they still form the majority of the patients who have STIs. So the major STI burden is in this young age group. But you can see that no age group is really spared, from people who are teenagers to even older patients who continue to be sexually active well into their 60s and 70s. So it's important to understand that no age group is spared in this. So these guidelines are meant primarily for family care physicians, and they are often the first point of contact for patients presenting with symptoms of genital ulcers and discharge. Many of them may not want to go to a hospital setting, for treatment. They'll rather do it in the confidential confines of a GP that he knows and trusts. Okay. The other reason why we decided to have this is because I don't know whether you remember a few years ago we sent out survey forms to many of you asking for your feedback, on whether you manage STIs, whether you routinely do lab tests and things like that. And this was a study initiated by our clinic. And what we found was that although many of you do manage STIs, we discovered that there was considerable variation in the way STIs are treated. And we thought that it was necessary then to have some guidelines so that there is some standard for you to follow. To end, of course, I would like to first of all acknowledge all the fellow members on this clinical practice guideline groups. Without them, I would not have been able to finish this task. Okay, so certainly I'd like to acknowledge them. Certainly we need to acknowledge the contributions of the MOH team. Okay, they were superb in all aspects of support, including the technical aspects as well as even the editorial aspects of it. And finally, I'd like to thank our sponsors,